Good evening, everybody. Welcome to the ENLIGHT series on lectures on health equity. We have three speakers today, and I'll be moderating the session. My name is Michal Molchko from University of Galway. I'm going to present each speaker before they talk, and then I'll invite them to present the topic, and at the end we will take questions through the chat. So our first speaker is Mats Målqvist, who is a professor for global health at the Department of Women's and Children's Health at Uppsala University, Sweden. And he's also currently the director of SWEDESD, which is Sustainability Learning and Research Center. Professor Mats Målqvist is a medical doctor by profession and has master's degree in media and communication studies. Health equity is at the core of his research and educational activities. And the topic of his lecture today will be the place of health equity in sustainable narrative. So we're going to you, Mats.
Thank you, Michal. I will now share my screen, and I hope you can all see our beautiful logo of Uppsala University. I'm very happy to be here and get the chance to give this short lecture on the place of equity in the sustainability narrative. This is my first slide with the headline. As said, I'm now working within global health and sustainability, since I see that equity issues and global health issues need to be merged with the sustainability narrative that is currently very much in fashion for various and acute reasons. So in order to place equity in the sustainability narrative, I think we need to start by looking at the sustainability narrative. What kind of narrative do we have? And one is, of course, the catastrophe that is very often mediated in media. We have emerging infections, different pandemics. We have climate change, forest fires, hurricanes, different events. We have also the sixth extinction coming up with loss of biodiversity. We have a lot of migration crisis at our doorstep. And of course, not the least, we have the threat of antimicrobial resistance. So all this is one narrative of sustainability, the catastrophe that is approaching. This could be expressed in many different ways. For example, in the limits of growth, there are many different ideas of peak everything that was reached, according to some, already at 2018. So that's one way of looking at sustainability, acute stage, a crisis that we need to handle. Another narrative, which is of course not less urgent, is the narrative of planetary boundaries. This was brought up as a conceptualization some years ago, which basically means that there are certain thresholds where resources will be depleted, and we will not have a sustainable world. This idea of planetary boundaries is, of course, very much oriented to the ecological sector, the environment sector. It's very much a natural science approach to sustainability. Another narrative that tried to kind of modify and moderate this narrative was the so-called donut by Raworth and published in the Lancet in 2017. The idea that these planetary boundaries are out there, it's our external environment, but we also have a social foundation that we need to consider, that the sustainability narrative, the sustainability discussion needs also to embrace the social fabric that we live in, and that if we're going to achieve a sustainable world, we need to stay within this donut space, the green space here. We can't overshoot our resource consumption, but we cannot also neglect peace and justice, health situation, education, etc. Things that bring up that make up our societies, make them stable, and where we can thrive and live, and actually be able to counter these shortfalls or short overshoots, the lack of resources we have. So now we are getting closer to where equity fits in. Another narrative in sustainability is the 3 dimensions of sustainability, where it is acknowledged that we need to look both at ecological factors, the social factors as in the donut, but also on economical and political factors, and that these 3 dimensions need to be addressed at the same time. Another narrative is the Sustainability Development Goals narrative, where different goals, as we all know, have been set up for a sustainable world and sustainable development. And here we find health as one part. Here the social dimensions are interlinked, so to say, and mixed with the ecological and the economic and political ones. We also know that these sustainable development goals are interacting with each other. Some are reinforcing others, some are counteracting others, etc., which makes it more complicated than just striving to maintain within the planetary boundaries. These interactions acknowledge the fact that it's a complex problem. It's a wicked problem that cannot maybe even be solved. And health is part of this. It's an interconnected entity, and not only health, but also health equity, the fair and just distribution of health outcomes. And WHO has taken it even further and said that health is actually the foundation and the purpose of the whole sustainability narrative. We would like to put good health, SDG 3, in the center, and because all the other goals, they are basically leading up to health. It's about living conditions for everyone. So that's, of course, a very anthropocentric viewpoint, but it puts health in the center, and also health equity. Another narrative where health equity is even more pronounced, and this is actually my last slide, and I would like just to stay a little bit with this one. This is from the Footprint Network, where you can see 2 axes. One is the x-axis, we have Human Development Index, and on the y-axis we have ecological footprints. And this is, you could say, a combination of the donut. On the x-axis, we have the strive to get everyone as far to the right as possible. That's actually an equity issue. It's something that global health has been working on for quite some time, to get the gains of modern medicine and the public health knowledge, and how we build good societies to all people. What global health and the health equity scholars, if I would put it that way, have been maybe neglecting is the cost in climate, the ecological footprint that these improvements demand. And on the y-axis we can see that the further to the right you are, the more resources are also consumed, and that it is almost not linear, but like a logarithmic association between these two, which means that health equities, a strive for health equity, needs to be framed as also a strive to achieve equity within the planetary boundaries that we have. We cannot only push for health equity without also engaging in how we should do this within the resources we have. If we don't, that means that we are only working on one dimension of these three-dimension picture of sustainability, and that will lead us astray, basically. This is not a very easy task, of course. We want to end up in this light blue quadrant down in the right-hand corner, the global sustainability, sustainable development quadrant. But this might be a wicked problem. This might be even impossible, but we need to reframe our health equity to work on both of these axes and not on one only. So that is my try to frame where we are on health equity now, and what narrative we need to start to embrace in terms of both health equity and sustainability. Thank you.
Thank you, Max. That was very brief and very interesting. And I think that this is one of the things is to think about equity in the broader possible way. I need you to stop sharing your screen, please.
Yes.
Thank you. So the next talk is about structural determinants of adolescent mental health, and it's not unrelated to obviously equity and the crisis that you mentioned. The next speaker is myself. My name is Michal Molchko. I'm a professor for children's studies at the University of Galway in the School of Education, and I'm a member of the HBSE, the Health Behavior in School Age Network, since '97. All my work is focusing on inequalities and adolescent health. And today I'm going to talk about adolescent mental health, but from the perspective of social and structural determinants. And it is work that is based on a chapter that was really recently published. And I'm just going to share my screen. As I said, this is based on a chapter in a book that was published by my colleagues. It's called Understanding Youth Mental Health. And I'm going to talk in this lecture about, first of all, mental health. What is mental health? I'm going to talk about structural determinants of health. What are they? What do they mean? What do we mean when we say that? I'm going to talk about structural determinants of mental health and how should we move towards achieving equity in mental health. Now, the first thing that I would like you, or when we finish, by the end of my talk, what I would really like is for you to appreciate that mental health is not a personal thing. Okay? Mental health is defined as a state of mental well-being that enables people to cope with stress of life, realize their ability, learn well and work well and contribute to their community. WHO is really good at having very complex and rather to a degree meaningless definitions of health and mental health, but there we go. We do know that there is increased focus on mental health in recent years. We do know that mental health was damaged, was scarred, if you like, by COVID. And there's an increased awareness of the importance of promoting mental health and preventing mental illness. So this year we had the title of Make Mental Health for All a Global Priority, which should fit theoretically to Matt's framework of SDGs. Last year we talked about mental health as a matter of equity or fairness. And really, the World Mental Health was 2 days ago. The Mental Health World Day started in '92. And we have an increased focus on how do we improve mental health. And we have a lot of interventions. I'm sure most of the people that are listening to this have been invited to take mindfulness sessions by the workplace. There's toolkits, there's training. Children in school are asked to engage in mindfulness. But what we need to remember or to appreciate that it's not really just down to the individual. It's not a personal thing. There's a lot of other aspects that are influencing one's mental health. Or in other words, if you're a child and you're poor, you don't have food, or you don't have money to afford heating, and you're not going to sleep at night, you're not really likely to benefit from mindfulness session in school. That is not your problem. And that's why I want to talk about structural and social determinants of health. Again, I love that when people say this is not a good slide because it have a lot of words in it, and then I do that. But when we talk about structural and social determinants of health, we're talking about the complex and integrated overlapping social structures and systems that influence our being. We're talking about those that are responsible for health inequities. They include the social environment, physical environment, services. So that will touch on Ben's lecture later. Social factors, and they shape the distribution of money, power, and resources. And WHO basically said quite clearly that in the context of people's lives, when we are talking about mental health or health, blaming the individual for having poor health or crediting them for good health is inappropriate, because a lot of those determinants are actually outside the control of the individual. So any difference, and essentially any evidence that we have of different prevalence of mental health across different groups suggests that we're viewing inequalities. Because if there weren't inequalities, we would have expected to see all diseases distributed in the same way. If this was just down to genes or just down to your makeup, we would have expected to see equal distribution of all health outcomes. And when we don't see this, that's where we should start to question, what are the other determinants or causes of causes, as Sir Professor Michael Marmot called it in 2008. When we talk about social determinants of health, it's about the conditions in which people born, grow, live, work, and age. And when we're talking about adolescents, we specifically are talking about conditions where children are born, grow, live, and are educated. So this is where we bring in the education system. And this is going to shape the next part of my presentations, where I'm going to talk about those different conditions that people are grow into, are born into, live, and are educated. And to do that, I'm going to go through various environments. So the first environment that I'm looking, or the structure I'm looking at, is socio-demographic background, which is something that one cannot control. Okay, and the evidence is quite clear. If one is born into family with a low socioeconomic status, or is a member of a minority group, they are more likely to experience poor self-rated health and poor health status. And this is because differential exposure to health exists in different settings. And this could either enhance one's health or damage one's health. And that could be to do with the environment, the physical environment, pollution, access to clean water, access to education, access to employment, access to healthy food, or just to foods shops where you can get affordable food. And we know that those that are from more deprived background, more likely to live in what is called food deserts, where the only shops that are around and accessible are convenience shops that don't have healthy options, and that everything is more expensive there. Okay, so that means that the exposures and experiences are very different. So social demographic background is going to result in various differential access to different resources, and therefore in differential outcomes. And what we know is that lower socioeconomic standing, irrespective of absolute income, is associated with increased risk for developing mental health problem. So it's not just about the money. It's also about where you are situated in society. But we still need to talk about money as well, because we know that income inequality and poverty also play a very important role in one's mental health. So living in poverty increases the risk for depression, anxiety, and suicidal ideation, simply because somebody lives in an area or does not have enough income. And I'm going to talk about what we can do about it, because funnily enough, this is something that we can tackle. High level of income inequality in a country, meaning when the distribution of income in a country is very wide. So there's people that earn a lot of money and people that earn very little, irrespective of one's absolute income or poverty, increases the risk for mental health problems in adolescents. In other words, if I have little, but I know that some people have loads, that is going to impact on my mental health. And when we are bringing down that inequality or that diversity in income, we're actually decreasing the risk for mental health problem, okay? And this is without even talking about the individual or doing any intervention at the individual level. And linking to that, we can talk about COVID-19, because really we cannot talk about mental health without addressing COVID-19. So for people, children that have houses that are well connected to the internet, that have parents that were able to continue to work during COVID, that were able to continue from home and support the children, they had one type of experience. But for those that didn't have connectivity, didn't have devices to do homeschooling, didn't have support, or have parents that don't have the level of literacy to support them, this is going to impact has impacted their academic achievement. It is very important to remember that that this is part of the story. So during COVID, people would say, oh yeah, we're all in the same boat. But no, we're not. Some of us have yacht and some only have rafts, okay? And those rafts don't always even make it to Europe when they're trying to migrate. So just, this is the impact of income inequality and poverty on mental health. Moving on to race and racism, we are seeing a great increase in migration. This will further increase because we know that with climate change, there's going to be more areas that will be not livable, and we have to talk about it. So it's important to recognize that race is not a biological fact. Actually, the differences, the genetic makeup differences in genes within any group is larger than between groups. So this is not a biological fact, it's a social construct. And therefore, when we have health disparities, we have to understand that they're not biological and to do with race per se, they are the result of racism. Racism is defined as organized systems within societies that cause avoidable and unfair inequalities in power, resources, capacities, opportunities across racial and ethnic groups. In other words, this is what we can actually control. We can't control biology to a degree anyway, but we can control racism. And when we see structural racism, when we see systems that support racism, that enable racism, that enable exclusion, and sometimes violence, we see an increase of mental health problems in people that are being marginalized, that are being discriminated. We see lower self-esteem, we see poor mental health outcomes, and perceived experience discrimination is also the fear of being discriminated. You may not have experienced yourself racism, but the knowledge that your ethnic group is experiencing racism keeps you on high alert. That in itself increases the secretion of cortisols and other hormones that are going to impact your ability to function and your mental health. Moving to the school environment, as I said, access to education and education in itself is one of the strongest predictors for mental health. It's one of the biggest, the strongest social determinants in adolescent health. And that's obviously, it's quite clear. It's also the main environment for adolescents. This is where they're going to spend most of the time. And it's also the key environment for developing identity and for socializing. So this is where adolescent is developing their separate identity, separate from the family. But it also an environment where which is the main cause for pressure and stress, mainly around academic achievement, mainly for girls. And it's also a place where some of the socializing is not healthy. Most of the bullying takes place at school. Okay, so there's two sides to schools. There's the part that supports growth and supports positive mental health, and there's the part of the school experience that can actually result in poor mental health. Another key environment for adolescents is the digital environment and mainly social media. Now, we tend to think about social media as mainly evil, but obviously it's not. It has both negative and positive impact on mental health. It does and can give a sense of belonging and answer the needs of social connectedness among those that feel excluded in their immediate environment. And it was the one place that actually saved a lot of children during COVID. But we also know that prolonged exposure to social media, and especially exposure to negative comments, harms mental health. So if you're more vulnerable, and if you're therefore go and spend more time in social media, and your friends, quote unquote, are putting negative comments, and you constantly go and watch them and view them, that is actually very harmful. And those that are more socially excluded are more likely to engage in problematic social media. So really what we're looking for is to think, how do we support children to know when to engage and when to disengage, when it's becoming a problem for them. And we know that the companies are really good at putting algorithms that keep children, adolescents involved, especially through exposure to negative content. But that's not for today. COVID-19 really gave us a view of what mental health is going to look like at time of crisis. The prolonged school closures and lockdown policies had huge impact on children. Again, not all children, but for those that were relying on free meals at school, for those that were in abusive houses, for those where they didn't have any support in the home, this homeschooling was a disaster. For others that are coming from better backgrounds, from higher socioeconomic status, from families that have different, that have occupations that allow them to work from home, the impact was much less harmful and sometimes even good. COVID created fear and worry about vulnerable family members, the fear that you're going to pass on the illnesses, the disease to your grandparents. It reduced social interactions at the time when social interaction is so important. This is the time of adolescence. There was lack of school routine, which is important, especially for vulnerable children, limited school support, and again, very, very differential. So we cannot assume that the crises are going to impact kids, different children in the same way. And this brings us to the point of discussing equity, or how we are dealing with those inequalities and create a more equitable environment. So what are we going to see? And I think, Mats, you're really good at highlighting the future, which is a bit bleak at the moment. We can see the increase of cost of living. And as I mentioned at the very beginning, for children that don't have money for food, mindfulness is not going to help. And we are seeing across all of the world, really, the increased cost of living. We're at risk of recession. Some would argue this is beyond risk. This is now the future. We have civil unrest, and we'll see more of it, because when the cost of living is increasing and there's more migrants, people are reacting. And there is the reality of climate change, which I think the last summer really brought home. Climate change is not new. It has been discussed in the 60s. The first panel meeting was in 86, if I'm not wrong, or 88. But it feels like in the last few months, the reality of climate change really hit home. And that means that we're living a time of uncertainty. So what do we do? How do we achieve equity in mental health? So how do we create certainty and safety in an uncertain world? And therefore, even at the biological level, reducing the levels of stress hormones. And the key thing is to control what is in our control. Social demographic background isn't, but the rest of it is. So when we're talking about adolescents, holistic education is one of the key ways to go. And holistic education is about putting less emphasis on your academic achievement and more emphasis on well-being, health, and creating an environment that is safer for children. Again, safety and certainty are the things that are more important. Put it this way, if you're first year in secondary school, there's absolutely no reason to put pressure on you to prepare for your final year exam that will come 6 years down the line. We need to reduce inequality through social transfers and benefits. We know that income inequality exists, but we can reduce it by making sure that those that are earning more will pay more taxes, and that those monies will be transferred to those who need them both through benefits. We have seen what the idea of removing some of the taxes in the UK did for the economy. So before talking about the free market, we see that actually the market does favor reducing social inequalities or income inequalities to some degree, and we really should adopt that. We should improve access to services and make sure that those that have limited access will have more of it. We need to make sure that services are good. We need to invest in medical services, social welfare services, mental health services. And we really need to acknowledge that mental health is not just a personal thing. So we need to first fix the systems before we're trying to fix people. And that is for me. So thank you very much. And obviously questions will be welcome at the end of the presentations. Yeah. So our next speaker is Ben Robayes, and apologies for butchering your name. Ben is a junior researcher and at the Research Group for Media, Innovation and Community Technology, MIC, in the Department of Communication Sciences in Ghent University. And as a researcher, He has experience and expertise in project for societal value creation by conducting living lab and design thinking methodologies in order to collaborate with local stakeholders. Within the last 2 years at MICT, Ben was active on a wide variety of thematic projects regarding innovative interfaces in order to solve the problem of loneliness with elderly citizens. And his talk today is about how can we make healthcare more understandable for all citizens of Ghent. So over to you.
Okay, thank you, Michal, for the introduction. I will first try to share my screen. Oh. Normally you guys should be able to see my presentation right now. I think that's okay. Okay, so good. I'm going to talk a little bit about the Come On project in the city of Ghent, in which we would try to tackle wicked problems like Mats was mentioning before. So it will be a little bit more hands-on, a little bit less academical. So I'm going to talk about how do we tackle these problems more concrete, how do we make healthcare more understandable for all Ghentian citizens. But to start my presentation, I'd like to, of course, begin in the city of Ghent. And in the city of Ghent, you have the public library, which is De Krook. Nevertheless, a lot of civilians of Ghent know this library as the library where you can rent out books, where you can share books as well. But De Krook has to offer a lot more than that, more concrete. In De Krook, we are also we have a lot of stakeholders over here. So who are these stakeholders? Well, first of all, this is the city of Ghent. Next, there is IMEC, which is a technology company in Flanders. We have the University of Ghent, where I'm part of. And lastly, we have the library of De Krook. And what we know is that actually the partners here at De Krook, they possess a lot of knowledge. So the city of Ghent knows a lot about governance. IMEC knows about technology development. University of Ghent has a lot of academical knowledge, and so on. So what do we want to do in Common is actually combine these different kinds of knowledge in order to think about concrete solutions for wicked problems that the city is facing today. But more than that, we don't only want to collaborate with these stakeholders in De Krook, but we also want to activate the ecosystem in the city of Ghent, where among there are, of course, Ghentian civilians who also possess a lot of knowledge. You have social caretakers, for example. You have also elderly citizens who know what kind of problems and needs that they potentially have. You have people with from an other ethnic origin that know what kind of problems that they have. So what we want to do is actually collaborate with them, and of course also with companies in the ecosystem of Ghent in order to find these concrete solutions for the wicked problems that we are facing on. So why do we want to do it? Well, first of all, I already explained it 2 times. So we want to have innovation at the intersection of technological expertise and societal challenges, these wicked problems. We also want to facilitate experiments and co-creation with citizens in order we can get to know more knowledge to share it between the stakeholders in the ecosystem of Ghent. We want to support the development of digital skills of the Ghentian civilians. We want to stimulate new collaborations and also critical reflections among the Ghentian civilians to think more critical about these wicked problems and potential solutions. So how do we want to do that actually? Well, first of all, we try to find challenges. So these wicked problems, it's often used as a buzzword in these times, where a wicked problem is still really abstract. So what we want to do is actually collaborate with citizens in order that they can choose the problems that we want to tackle in common. Next, we want to look like what does already exist within this problem as solutions. So we do conversations with experts, we have workshops with experts, we have interviews with experts to have a clear view on what is already known today. Then we want to come up with potential solutions in co-creation with citizens, so they can think about like if we conduct or apply a solution within the city of Ghent, how do they see this solution? What do they expect? Then we look at what solutions are possible by working interdisciplinary, working with engineers, for example, in order to assess whether if we come up with a new idea, a new concept, that we can see that it's feasible or not. And last, we look at what solution is desirable. So we can also use all the knowledge that we create, that we collect in the Common project, that we can discuss with citizens in order to create a public debate as well. So more concrete, I was going to talk about the understandability of healthcare, or the challenge. How do we make healthcare more understandable for every living citizen in Ghent? Well, we came up with this problem by conducting a crowdsourcing methodology. So we asked the citizens of Ghent, like, what kind of problems do you experience? And then we came up with this one. So this was more or less still quite abstract, so we wanted to narrow this down. How do we do that, this narrowing down? We did some emphasizing and defining concrete problems by conducting workshops. This was also really hands-on, was a really fun day. We conducted workshops on different rafts here in the city of Ghent. So we collected stakeholders from the ecosystem, nurses, doctors, people active in healthcare, in order to understand what kind of problems that they experience today. And also we did some interviews with civilians as well, in order to have a clear view of what kind of sub-challenges we have within this main challenge. For example, how do we overcome language and cultural barriers in healthcare? How do we simplify complex jargon in medical and care context? How do we strengthen communication skills of patients and caretakers, and so on? So we had a lot of different challenges that we were able to try to find an answer for. Oh, sorry. So with these challenges, like I said earlier, we were exploring solutions with civilians as well. So we invited a lot of people from Ghent, people who were interested. They were also attracted because of the challenges that we provided. And in collaboration with them, and by conducting co-creation and design thinking techniques, we came up with a set of solutions. And maybe to give some examples of these solutions, at the left you can see an application which reminds you of the consultation that you have to go to, because apparently one of the problems that we discovered was that some people tend to forget their consultations at the doctor, and therefore a lot of time at the doctor is wasted. Or the other at the right, as you can see here on the slide, a smart speaker was developed for different citizens, where you went to the doctor consultation, and then there was a live recording of what was said, and then there was simplified in an artificial intelligence voice assistant that could help you in remembering the most important things that the doctor said. So these are two examples of what we came up with the Ghentian civilians. But of course, these were not the solutions that we actually wanted to develop. We actually wanted to use these solutions as within a research through design context. So with these solutions, we went to 3 different neighborhoods, to the libraries in the neighborhoods, and we started to talk with citizens. They had to give their opinion about these solutions, give feedback on it, what was good of these solutions, what was bad of these solutions, and also have some suggestions to make them even more better. And actually in that way, we were able to get a nice overview of challenges, of what these challenges contained. So with this overview, we wanted to work towards more concrete solutions within the understandability of healthcare. And this is where we organized the Common Maak Marathon, literally translated, this is the Common Making Marathon, where we challenged 45 students from the city of Ghent who are studying here, where we challenged them to come up with prototypes, to develop a concept, to create this concept and actually make it tangible in order to have it as concrete as possible. This was in a competition format, and actually the best concepts of this format were further developed in the Common Microlabs, because we are in a situation at this point in the process where you have a concrete idea, you have a concept, but then the question is, how can you actually implement it in the real life context, for example, in the market? And this was actually one of the biggest challenges that we are still facing today. So what did we come up with? We came up with the common micro labs, and the common micro labs are it's actually a method where we use the design sprint. This is a format of 1 week, and in this 1 week you actually remix the concept, you try to look critical at it, and try to come up with a more concrete idea to eventually test it at the end of the week. So we came up with this method, and invited people from among the city of Ghent who were interested in further developing the concepts. We invited them to collaborate in this. And this way we wanted to give them a little bit more ownership in order that they would, after the common project, that they would actually try to implement it within the market. So we try to activate the ecosystem, and then let the ecosystem do its work. So the micro labs, we are organizing 5 of them. And so, like I said, we want to make it more concrete. We want to actually implement them in real life contexts. And to do this, we actually have some more resources to offer to the different stakeholders who want to participate in this step. So what do we provide as resources? Well, first of all, there is 12,000 euro of prototyping budget. So they can actually have like a kickstart of making the prototype even more tangible, to make it work, something workable. And then we want to support them in further testing it out in real life contexts, by organizing, for example, experiment cafes here at the Krok. So they would be able to gain more insights and like, would this prototype work or not? We would also support them by making business models around it. So this is a development and collaboration with Common. So the thing is that we want to actually support them and kickstarting them to make it more feasible to put it into the markets or in the real life context. So the microlab was also given the ownership to spend this budget of 12,000 euro. And up until now, we came up with 4 outcomes. And these outcomes directly need to offer a solution. I do not say the solution, but offer a solution to make healthcare a little bit more understandable within the city of Ghent. And these are these concepts. So first, we developed Dolox. I will show a little video after my explanation to show what it looks like. The first one was Dolox, which is a watch that is designed to constantly measure pain for chronic pain patients. So one of the challenges was that pain patients have a hard time to communicate their pain over time towards a doctor during a consultation. So Dolox is actually a watch that you put on, and during the day it asks whether you have pain or not, and then give it a score, and then also give some context information with it. For example, did you take your medication in a good way? Or another example, did you sleep good last night? What kind of activity were you doing? And with this information, the doctor would be able to assess it beforehand. So the consultation from the doctor or at the doctor would be a little more easy for the doctor and less time consuming. So this was the first one. We are actually in a stage right now where the prototype is more or less developed. It still has a lot of or a few children aches, but we want to test it in a few weeks to further develop it afterwards, so to iterate on it. Then the second one is Ringli. Ringli is a voice assistant to keep foreign civilians updated on doctor consultations. So another challenge that was formulated was that foreign civilians after have a hard time to communicate with the doctor, that they tend to forget their appointments for the doctor consultation, or they ask their children to help them in remembering it and also to translate it, the consultation, or the remembering of the consultation. So Ringli is a voice assistant that calls a person with a foreign language 2 days beforehand to remember that the consultation is going to happen. And also in this voice assistant, you can also give the confirmation that you are going. And this is all in the language of the civilians that are using Ringli. So these are the 2 micro lab outcomes that are already developed. And now we're going to start with 2 more micro labs, where the first one is Spexter, which is an artificial intelligence which translates the doctor consultation to snackable text. So after a consultation, there is a speech-to-text engine who translates the speech during the consultation to text, and then this text is simplified in order that people can read it afterwards to remember the most important information from the consultation. The last one is TherapMe, which is a matching app for clients and therapists. So, well, especially in the context of Ghent, with a lot of students, it's still sometimes a hard, students or clients have a hard time to find a therapist who can be matched on like a personal level to a therapist. So this app would make it able to match the clients to the therapists eventually in a more sustainable way, and then that way the therapist could also save more time. So now to end my presentation, first at the right you see one of the test persons that is using Ringli. This is a Turkish person who gave a lot of feedback during the tests, and also gave some suggestions. And the little video here is the prototype of Dolox, so the watch to measure pain during the day, where it is now in the prototyping phase. Oh, this is not, can I, okay. Okay, so like you can see for Dolox, for example, during the tests, during the design sprints or the micro labs, we know that the tactility of the interface is sometimes a little bit hard, especially for people who have like problems with their, I'm sorry, I can't find the word in English, with their motorics. So therefore we wanted to make something easy to manage, and this is why the ring around the watch is on the Dolox watch. So these are the prototypes that are developed up until now. And yeah, so the road still continues. I give some explanation about the methods that we use, what the preliminary results are up until now. So yeah, and whether the applications would be in the market or the real life context is still a little bit unknown for us, the result of it, but that's why we are experimenting with these kind of methods and also hands-on solutions to make it a little bit more concrete for the Ghentian civilians as well. So if you want to have some more information about Come On, we have the website. It is in Dutch, but maybe you can use a translator on it, or you can mail to hello@comeon.ghent, or you can also follow us on Facebook, Instagram, Twitter, and LinkedIn. So yeah, thank you for your attention.
Thank you very much, Ben, and thank you, Ben and Matt. I think it's be good for us all to be on cameras. And if there's any questions, I invite questions from the audience, whoever is here. So if there's anyone who could put you're welcome to put your questions there, and I'll read them out. So. Question about the mental health teenager, what role can school play? It was said, okay. So basically, I'm not sure what vacant schools may mean. How do we deal with bullying a school, or how do we create schools to be more supportive of health? Basically, the main approach that works best is a whole school approach, which is working with children, working with teachers, working with parents to create a safe environment. And when it comes to bullying, it's about making sure that kids understand that they need to report bullying, not to intervene, but to let others know, so they can stop it. Make bullying unacceptable. Whether you're the bully, whether you're the victim, there's going to be consequences, but also just for those that are bystanders. So bystanders of bullying also suffer from their mental health, would also suffer. So as soon as the school understand that bullying is a community problem, and for community problem, we need community solutions. You can adopt a community engage, if you like, borrowing from Ben approach for holistic education and for a whole school approach that creates a safer environment. And Evan, I hope that answers your question. If not, by all means, do upload a follow-up question. Looking to see if anyone else has a question to any of us, and if not, Ben, you can take this question. The professional from medical area overview the solution, e.g. whether simplifying is still correct.
If I understand correctly, you ask if that the professionals are also involved in the testing of the solutions, right? Yes, yes, they are involved. Actually, what we also want to do in Common is creating a community of interest, we like to call it. So around this this challenge that we have right now of understandability in healthcare, we also like to involve the professionals. So in the different steps, we involve them to first empathize a little bit, so to see what already exists, but also now in the testing of the interfaces, we also ask them, also during the design sprint, we also ask them to give some feedback whether it would work or not. For example, a critical thought of some therapists today for the Dolox watch is that we could actually, if we ask 3 times a day, for example, with Dolox, whether the patient has pain or not, this could actually engage the pain for the clients who use Dolox. So this could be a problem, and therefore we are now thinking about different solutions in collaboration with these professionals.
There's a follow-up question for you, Ben, around whether what is the way, what mechanism to create to prepare the community, get the community ready for community engagement. And Yvonne, I'm going to get back to you on your question about school implementation after Ben will take that.
Okay, so one of the things that we see within Common and also former projects that I worked in with is actually the central problem that we are using actually has some kind of attraction. So a lot of people who are interested within the central use case, which is now understandability of healthcare, they seem to be attracted to this project. So by actually applying a lot of communication within the city of Ghent, like you saw, we have like an Instagram account, a Facebook account. We also have a community that we send to with mail. People just tend to get attracted and want to participate within this community. And that's actually the strategy that we are using right now. And up until now, that actually worked pretty fine. A lot of people are interested and like to share. And then we just ask them to whether they want to be part of the community. And so we put them in the community, give them some update mails, give them updates about events that we organize as well here in the Krook. And if we then have more concrete research steps where we need more specified or more concrete information or feedback from them, then we send them personal mails to actually or call them to actually activate their knowledge at the time that we need it within the process of developing the solutions.
Thanks, Ben. I'm going to go back to Yvonne. You've asked about how can school implement this. There's actually quite clear guidelines on how to implement a whole school approach. I'm happy to follow up with you individually. You can email me and we can talk about it. But it does require to start getting involve all the stakeholders in the school, and that really does mean that you need to get a buy-in from teachers, from the principal, from parents, from children, but also from all the support systems that are from administrators in the school. But the systems are there, the protocols are there. It takes an effort, but it does improve significantly everything around school. It improves achievements, it improves well-being for everyone. So yeah, there's a lot of evidence around that. And again, the talk isn't about it, but I'll be more than happy to follow up with you. I don't see any more questions coming, so I think perhaps we'll end the session. And And in the chat, there is a link for our networking event. So yes, feel free to join and have a conversation on the other room. So I will let our host. Okay, sorry, yes, another chat. The first talk. So Mats, this is for you. What do you mean that we in the West have given up more to create greater, or should give up, or to give more greater equilibrium?
I'm not sure I understand the question. Give up more to create. Well, okay, yeah. So you mean that in order to reach the development, the sustainability quadrant, we need to lower our standards. That's basically the question, right? Well, I think we need to separate the idea of living standards from ecological footprints. The challenge is to find either new ways to define standards of living that where we still can maintain the gains we have made. The other way is, of course, which is often referred to as the technology fix, that we maintain our standards by new technical solutions that lower the ecological footprint. So it's in a way, it's not business as usual that is possible anymore. We cannot do business as usual. So with the business as usual approach, yes, it would be to give up and to bring down our living standards. But we need to solve this by new approaches, either technology fixes or redefining the societies we live in, redefining the expectations, basically, and our viewpoint of what is needed in terms of human development in this. I don't know if that was a correct answer, but as my late Swedish fellow Professor Hans Rosling said, that we cannot assume, we shouldn't fall for the linear principle and assume that things will continue the way it is right now. There is for sure development of all kinds in technology and so on. There is also technology, or there's also development in societies and shifts like the community engagement we heard about here, that changes lifestyles, changes expectations in a good way. The grassroots movement can surely change this, but we need to make a conscious decision on achieving that. And for that, we need to see what the problem is right now. It's both getting everyone to enjoy the good health and the good life, and doing so while reducing the ecological footprint. And that, I think, is the challenge. If we miss one of these, then it doesn't matter how much equity we strive for, right? We can't hear you now, sorry.
Maybe that's a good thing. Thank you, everyone. That was thank you for your session, Mats and Ben, for your contribution. Thank you for those that came and listened, and for those who are watching it on YouTube. And I think we'll end here. So have a lovely evening.
Thank you. Bye.
Thank you very much. Bye-bye.
Det är roligt.